In the mountain kingdom of Swaziland, the Red Cross van winds its way along the dirt roads and up to the remote rural homesteads. It's vital to get medication to people like Kulsila Nyamani. She contracted TB 2 years ago.
Bengikhwehlela nakhona ukuphefumula uvaleka ngiphefumula bese sengiyafoma fikela ngamakhatha nokushisa.
When she first fell ill, Kulsila made the hour-long journey to the local Sigumbeni clinic, but she couldn't keep up the regular visits. Sanele Mkonta, who's treating her now, is a nurse and the head of the TB section at the clinic. He understands her situation as public transport is unreliable.
Whether they want to reach there or not, they can't because there's no transport.
Kulsile couldn't take her medication every day as required. She developed a virulent strain called multi-drug-resistant TB, which she's now on medication for. This strain of TB often occurs when patients don't complete their initial treatment or the incorrect medicine is prescribed by their doctors. You can also be infected by living or working close to somebody who has MDR TB. The Bafalali Swaziland Red Cross decided to strengthen its home-based care. Home-based care allows people on treatment for MDR TB to stay at home instead of being hospitalized for many months, often far away. With the help of the Lily MDR TB partnership, Sanele now visits more people in their homes.
I think it's very important for us to come to bring the services to the people, not the people to come to us. If we can do that, I think we can eliminate it in Swaziland completely.
That's a huge challenge in a country which has the highest AIDS infection rate in the world, and TB is rife. But small victories make a difference. Kulsile is getting better. Home visits are vital, believes Nati Gumedi, the Secretary General of the Bafalali Swaziland Red Cross Society.
For us, going closer to the people is the key. We also would like to provide the service at community level, make sure that our nurses are given capacity to provide testing and treatment at the community level.
Nurses and healthcare workers are especially vulnerable to TB, and in the bustling commercial capital of Manzini, there's now a special clinic for them. Nurse Laureen Dlamini has come to the Swaziland Wellness Centre to be treated for tuberculosis. She contracted TB through her work.
It's very risky. Even the infrastructure there, ventilation is not okay sometimes.
Petsila Mamba, who's won an International Council of Nurses award for her work in TB, is there to support nurses like Laureen.
They feel cared for. They feel they have something that is taking care of them.
In turn, Laureen can face her daily work with confidence.
I can have ways to stand those challenges, if I may say, because I've been treated and I feel fit and I'm more energetic.
The turnover rate among nurses has dropped since the Wellness Centre was set up. Healthcare workers are also learning valuable lessons through training courses. Petsile has been inspiring people to tackle TB.
When I'm at work, sometimes I go outreach to all the facilities in the country, spreading the word of TB, encouraging health workers to talk about TB on their own setting, to talk about TB with their patients, to talk about TB in their families.
It's clear that a passion for treating TB is needed in this small African country, as it is around the world, believes Luchika Dichu, the Executive Secretary of the World Health Organization's Stop TB partnership.
We need to do everything we can to dramatically reduce tuberculosis globally. We can do it only in partnership. And only if we can work together, we can find new ways to prevent, diagnose, and treat tuberculosis.
Despite hardship, the people of Swaziland are resilient. There are many who are determined to work together to beat the scourge of TB and AIDS so that the children of the country can move into the future with hope.